There was an article actually in the New York Times on the 15th, a couple of days ago, about the trend of mostly women, but some guys going into plastic surgery offices with pictures of celebrities asking to look like a celebrity.
Mm-hmm.
Now, there are doctors out there that claim that they're able to do that, and they will bring anybody on board and say, yeah, we can get you close. But the truth of the matter is, everyone's bone structure is different. Unless you really already look like this person as far as the bone shape, the structure of the nose, structure of the mouth, eyebrow, and all that stuff, it's unlikely you're really going to achieve that look. Exact same thing in hair.
Yeah.
Yeah.
I mean, I get this all the time. Guys, they'll come in with pictures of Brad Pitt.
Yeah.
Or Matthew McConaughey. And then I have to tell them, well, Matthew McConaughey is wearing a partial frontal wig, but,
Yeah, I mean, Specs tells me that people come to him with my picture all the time. So... No, but it is sad that people really they think that, okay, listen, these are the examples in our world of attractive people, but there are attractive people everywhere who aren't in the limelight and who are just they may be working at at Blimpies or wherever. And the bottom line is you need to work within the parameters that God has given you, and that goes with any type of cosmetic surgery. And a responsible doctor will tell a patient that.
Yeah.
But there's a lot of doctors, even some of the good guys, who are like, you know what, this is a $20,000 bill right here, just sitting there. All I have to say is, we'll try our best to get you there. And, instead of sitting down and saying, you know what, that's not going to happen, they don't want to turn somebody off because they know they're going to end up going at someplace else anyway.
And that's what prevents a lot of guys from actually, going that extra step to be honest about it.
Yeah, because they know the next guy's not going to be honest. So okay, even the good guys will say, at least I could provide these guys with a good product, a really good outcome. They may not end up looking and having Brad Pitt's hairline, but they're going to be a lot better off if they go with me than if they go to the guy down the block.
And there's some logic to that thinking.
Sure.
Right. I mean, if you have. Look, 22-year-old kid comes in and, maybe you don't give him that type of hairline, still force a bit more of a conservative hairline on him, but, you are, in a sense, preventing them from going to the next guy down the street that would do anything he wanted and giving him a really crap result.
That's true. So
right?
I understand that logic. And
the lesser of two evils.
It's unfortunate that, we're in an industry that even the good guys have to make concessions.
Yeah.
And,
I mean, I've seen those cases, and it's it's like, what do you do?
Yeah.
I mean, if you tell them no, they don't hear it. They just go right down the street to the next guy and get something that will devastate them for the rest of their lives.
Right. But you also have to, physicians and the clinic itself has to kind of understand that even though you're going to be providing a better product, unless this person is really psychologically sound and equipped to deal with a little bit of disappointment, then even if you're given a world-class hair transplant, in their mind they may still be disappointed, and then they're going to blame you.
Oh, yeah. Look, I mean, it's a minefield as far as the psychology of this goes. I mean, completely, seemingly rational, logical people that appear to be rooted firmly in reality, the best hair transplant in the world can be performed, and they still won't be happy.
Well, it's there's a lot of people that are going in for cosmetic surgery who are kind of at that tipping point.
Yeah,
they may have had a reasonable, psychological profile if they were to be profiled, or if they were to be, somehow assessed by a professional.
Yeah,
but they're on that tipping point. And if things don't go right, at least in their minds, that can tip them over the edge. So it's difficult. For patient selection is extremely hard. And I talk to doctors about this all the time. There are the guys in the IHRS and even other guys who just contact me who are not part of what we do just to ask for my advice. I tell them the worst thing you could ever do is to work on a patient who you're not at least pretty convinced is a reasonable person. And because careers can be destroyed because of that. And also you can end up, just unwittingly destroying somebody's life. Even if you're giving them a great procedure, they're going to be depressed for the rest of their lives because they're going to believe that they made the wrong decision.
Well, look, there is in a lot of clinics there are first lines of defense against things like this, and it's not the nicest term in the world, but it is exactly that. It's a line of defense, because when you have patients coming in that are exhibiting signs that would indicate potential problems down the road.
Right.
And keep in mind, like in my case, I am definitely not a qualified psychologist. I am definitely not, trained in psychology on any level. But there are certain common sense indicators that when I see as a red flag, I turn around and I communicate this directly to the doctors. And then they, it's a multi-review process where it's a lot safer to be pushing this guy away than to accept him as a patient, because if these red flags do pan out to be substantial, then it's bad news for everyone.
Well, you're right. It's interesting that I think it's important that the consumer sees this, because you're speaking from someone who, and I'm going to repeat myself, I say this all the time, who's in the trenches. Mm-hmm. I think it's important for consumers to understand how the clinic is, deals with certain circumstances, and how, there are a lot of difficulties that arise even with the best intentions. So patients need to be aware of that, and I think it's in their best interest for someone like yourself to be able to recognize, this guy may not be in emotional position to have surgery.
Yeah.
Now we spoke about them just going to somebody else, but at least you can rest easy knowing that, you didn't cause this, because if someone is never going to be happy, at least you know that you didn't cause this person to feel that they're to regret a decision to have cosmetic surgery.
Yeah. I mean, there are a lot of angles on how to look at this, and it's definitely a case-by-case situation. It's nothing you can rationalize in discussion, and nothing you can put down on paper as a template to follow. I mean, it literally just comes from basically having some common sense, some street smarts, and experience in dealing with this. This scenario of people coming in wanting to talk about hair transplants. What can we do for them? And also being in that position, right? I mean, there are people in this industry that have not had issues with hair loss, that have not had any sort of problems that they're trying to address with regards to their hair. And I've always questioned, and this isn't to degrade anyone or to undercut anyone's credibility, but I've always wondered, how do they really understand? Or do they really understand?
Right.
Right? I mean, you do, because you paint your head.
I paint my bald spot.
Every time you say that, I laugh, because I think of that interview with Larry King.
But you know what? And that's why we have it as a bit on the show, because it strikes a chord. That's what I do, and I'm fine with it. I have to tell the world about that, because there are so many thousands of guys who are just, they're sitting in fear in terms of being able to admit that there's, something that they're uncomfortable with when it comes to their appearance. But there is a fix. This is my fix. Yeah, finasteride, makeup, and a lot of hairspray.
Coast to coast and worldwide.
I just want to say, you guys are doing a great thing. It's such an uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Coburn's The Bald Truth.